and like 70% of these patients were growing out fungi.
Yeah.
And Candida
Yeah.
was definitely one of the main ones. So I thought that was like really important because yeah, you're not normally going to. We'll get into this later too with the gastroenterology stuff. You're not normally going to do such invasive procedures to make a diagnosis. I mean, hopefully down the line we'll have better testing, which I have suggestions for. I just have to find someone to come up and do it. I think you'll find it interesting. But yeah, I mean, I think there's like these little hints of proof, and we have to go on that.
Yeah. Yeah. All right, next chapter. We're going on to chapter 4. You discuss the diagnostic stages of Candida. Where did this come from, and how is it helpful in treating a patient?
Yeah. So again, my quote, I'm going to have to go back to Dr. Pasteur again. In the fields of observation, chance favors the prepared mind. I remember one of my medical school professors saying that line when we first started. And I was like, what does he mean by that? It takes a little while till something seeps in. And really it means, and I teach this to the medical students, is that if you're not looking for something, with open eyes, you're going to miss it. And I don't know I'm sure like yourself, like over the years, you think like, oh gosh, you're going to be this master clinician and see a rash and make a diagnosis. No, you have to look at hundreds of photos of rashes and do that kind of training to keep your eyes open to what you may see. It's not going to just hit you in the face. You got to be looking or thinking. That's the way I look at it. And that's kind of what happened though in taking care of all of these Candida patients that started coming to our practice. I started to see the and stage these different symptoms. I mentioned in the book essentially 4 stages that then it's not perfect, but it's uncanny how often patients have a combination, or I see them sequence through these stages, like where initially it's the gut, which again where the microbiome issue is. Then, and this is fascinating. Again, that's what I feel is a really important scientific contribution, is that then the patients have leaky gut. And Dr. Cohen, you and I know that as functional medicine doctors too, we also took a lot of flack for diagnosing leaky gut. Even though the patients all believe it, a lot of the other doctors are like, there's such thing as a leaky gut. Guts don't leak. But,
Yeah.
Dr. Alessio Fasano at Harvard, he used to be at Maryland, one of the probably most famous celiac physicians in the world.